Hello everyone, my name is Dr. Ssennyonjo. I am a sexual and reproductive health expert and trainer. You're welcome to my channel. If it is your first time being here, please subscribe, like and share. Make sure you don't miss out any video that we put out. Today I've come to talk about something very common, something that is disturbing a lot of people of late, and that is the persistent sexually transmitted infections. I've seen a number of clients who come to me, and these clients have been treated for STIs several times, but they keep getting the same symptoms. Most times they have improvement or relief for a few days, a few weeks, and then the same symptoms come back. Most times they do not get any relief, regardless of taking the treatment as recommended by the health worker who saw them at that time. Most times they actually get better and they're able to maintain an infection-free or a symptom-free period for like a month or two, and then the same symptoms come back. So that persistence in the STIs or the sexually transmitted infections is something that is disturbing a lot of people. Some I treat myself, give the treatment, but still they come back with the same symptoms with little or no improvement at all. So today I want us to dive into some of the causes of the persistent sexually transmitted infections and how we can do better in order to avoid this recurrency or the persistence. So what we need to first of all identify are the factors that are responsible or that might cause the persistence or the recurrence of the infection. And I'm going to list them down one by one so that we understand and look into yourself. You could be having one of these factors. One is you might have persistent or recurrent infection if there is a reinfection. And this means when you came to us, we gave you the treatment, the right treatment, you got better, the infection was cleared, and then you get a new infection. This could be due to a number of reasons. One, when you came to treat, you treated yourself, we gave you the treatment, however, your partner was not treated. So sometimes our partners can have the microorganism that is causing the infection without actually having symptoms. If we treat you, we give you the right medicines, but your partner remains untreated, there is a likelihood that you're going to be in a cycle whereby we treat you, you get better, and then you get reinfected by your partner. Not because they're sleeping around or having other people, but because they are actually harboring or they are a carrier of that microorganism and it was never treated. Other reasons could be lifestyle things due to you or yourself, especially with the reinfection, things like having multiple sexual partners. So even if we treat you and you're sleeping around with many other people, you might keep getting reinfected. And of course, not using things like condom or protection where you are actually at a high risk. You might be reinfected. Another possible cause of persistent STIs is treatment failure. And treatment failure happens in so many ways. One, it could be due to what we call drug resistant. Of late, we are seeing a number of microorganisms that are actually multi-drug resistant. You give your antibiotics as recommended by the protocols, and they won't work on these microorganisms that are causing whichever STI we are managing. This is because microorganisms are now mutating, changing their structure and their physiology to be able to adapt and resist the effect of these drugs that we're using. So in case you get a microorganism that is resistant, even if we treat, we might be wasting time, and that's where doing tests like culture and sensitivity come in handy to help us identify the specific drugs that will be able to manage your infection. Another possible cause of treatment failure is incomplete treatment. Most of these sexually transmitted infections, treatment goes for a minimum of 7 days. It can go for as much as 2 weeks, and it can even go beyond depending on what we are treating, the kind of microorganism, and the severity of the infection that we are treating. In case you get incomplete treatment, could be a prescription from the provider where maybe you're given for 5 days, yet you need a treatment for 2 weeks, you will most likely not improve. But also you've seen cases whereby we give a prescription, give you treatment, and then you share these drugs with other people at home just because they're having the same symptoms. So as you're trying to get a little bit of relief from the symptoms, you share these medicines with another person. And what's going to come out of that is you have incomplete treatment, and this microorganism will not actually clear. And this is even going to expose you to resistance, because this microorganism is now going to adjust itself to be able to resist the effect of these drugs. Another possible cause of treatment failure is incorrect diagnosis by the doctor or the health worker that is seeing you. In case the doctor or the health worker does not have a high index of suspicion and does not use the correct modalities to diagnose the infection you're having, you could have a misdiagnosis and you could be given treatment for something else when you're having something else. That's why we recommend going to professional and qualified health workers for the checkups. But also, in case the health worker requests for some investigations, please try to adhere and do them, because they're going to guide us when making a decision. Most of the STIs present with similar symptoms. You will see discharges, for example, from the vagina for women. You might have genital itching, among other symptoms. A few differences maybe in the color and the smell, but they usually present the same generally. So some of those tests enable us to make the right decision in terms of diagnosis, but also the treatment that we give. There are other reasons that could be responsible for the failure of clearance for the STI you're having, or for the recurrence, or for the persistence. Some of them include things like alternate site for the infection. So we could actually give you treatment for an infection that is in the vagina when this infection is also in other sites. And most likely there will be a scenario whereby this infection is moved back into the same position and it keeps recurring. Access to healthcare is also still a challenge for most people, and they tend to come when things are severe, things are bad, the infection is severe. And what happens is, in most cases, these people go to public facilities, especially in the rural areas, where there is no adequate treatment or medicines to manage this infection at the stage where it is. So most times they're given drugs that are unable to clear the infection, depending on the severity, and they keep having a little bit of symptomatic relief, but without necessarily clearing whichever infection it is. Underlying conditions also play a major role. Some people have conditions that weaken their immunity. Maybe you're, for example, HIV positive, or you're having some chronic conditions like diabetes, hypertension, cancer, among others. These expose you because they weaken your immunity, and an infection can easily come and give you terrible experience. In people who are otherwise healthy, their body tries to fight some of these infections without necessarily even requiring medicines. Yes, so weakened immunity or those underlying conditions can cause the persistence. Make sure that you do not sleep around with many people. Things like smoking, drinking, where you binge drink and then you go and engage in risky things, could cause the persistence. And this is most common, especially among the young people. So having talked about that, what can we do to actually prevent the persistence or the recurrence of the infection that we've managed? First things first, please adhere to the instructions as given to you by the health worker that is treating you. In case they have given you a given treatment for a given period, try to adhere and finish that medicine in the period that it is prescribed for. And in case you're given a review date, come back to be reviewed, because it is during those review dates that we're able to see progress and see if there's a need to push for a bit more period in terms of treatment, or we can now declare you infection free. Make sure that as you're being treated, your partner is also being treated, so that you do not have a cycle whereby you get better and then reinfected by the same person. Make sure you do not engage in risky sexual behaviors. Have one person as your sexual partner, and try as much as possible to use protection whenever you can. especially if you're someone who sometimes sneaks and goes out to meet other people. Do the necessary investigations as requested by the doctor. Sometimes we mind so much about the cost and we forget about why is it important to do this. So in case you have any doubts, always ask. The doctor will be glad to clarify as to why they are doing some tests or the tests that they are doing. But just try to adhere and do these investigations, because like I told you, they're going to guide us in the diagnosis and in the treatment. In case you have any underlying condition, make sure it is well controlled. That is, if you have HIV, make sure that you are adhering very well to your treatment and the viral load is suppressed. In case you're having diabetes, make sure that your sugars are well controlled. In case you're having hypertension, make sure that your pressures are well controlled. You'll be able to actually live an infection-free life when your immunity is working, is strong, and is able to fight off any infection. And lastly, do not wait for things to get bad. Whenever you feel unwell, try as much as possible to see a doctor immediately. Something managed when it is still early is better. Some of these sexually transmitted infections have very severe or very bad side effects and complications, some of which might even lead to things like infertility. So the earlier you manage, the better for an assuredly good outcome. I hope you find this video helpful and I hope you've learned something. Like I said, make sure you share it with your friends so that they can also pick something from this. See you in my next video and bye bye.